This conference will now be recorded.
But I'm excited to talk with you all and get to know a little bit more about your suicide prevention resources. So I'm a clinical psychologist with the Rocky Mountain MyREC for suicide prevention. So I have a number of different resources that I hope to share with you today, but I really want to hear from others just about what you're doing in your communities and what resources you have available to prevent suicide. So with that being said, why don't we do some introductions of who is on the call currently?
I'll start. This is Courtney Bowers. I'm the Colorado Veteran Community Partnership Coordinator / VA co-chair. So I'm happy you all are able to attend this morning.
And I'll go next. I'm Heather Camper. I am with the Denver Regional Council of Governments and our Area Agency on Aging, and I am the community co-chair for Veteran Community Partnerships.
Hi, my name is Leslie. I'm also with Denver Regional Council of Governments, and I'm a case manager, just started, so excited to be listening in.
Great, welcome.
We can call on you if you don't want to announce yourself.
Brian, I saw you just joined. Do you want to introduce yourself?
Yeah, sure. Hey, everybody. Good morning. Happy Friday. My name is Brian Stice. I'm a psychologist working at the Rocky Mountain Regional VA Medical Center. I'm in the position of local recovery coordinator. And as part of that role, I'm the community and mental health liaison for VA mental health service. And I'm also on the VCP steering committee.
Hi, I'm Katie Civiletto, and I work with Give an Hour. I'm the program manager for our reserve component programming, and we work also with the Campaign to Change Direction, the 5 Signs of Emotional Suffering, and Healthy Habits of Emotional Well-Being. And then Give an Hour offers no-cost mental health services for military veterans and their loved ones, for those of you who aren't familiar. And I serve on the steering committee for VCP and part of the mental health summits, and I wear a lot of different hats locally in Colorado Springs for now until we move to Oregon.
Katie, when are you moving to Oregon?
In 10 days, 15,
oh,
15th.
Wow.
Yeah.
I think I caught that at one of our meetings, but yay, okay, that's great to know.
Wow, that's soon.
Yeah.
So soon.
We're still trying to lock down a house, but it's happening.
No, yeah, right, no problem. Nice.
Yeah, but I'll still be involved locally, since my role with Give an Hour is nationwide. I still have a lot of flexibility in what I can work on and how I can be involved in various communities, which is kind of cool.
That's great. Well, congrats, Katie.
Thank you.
I'm Julie Maxon. I'm with Dignity Hospice of Colorado. I work with partnerships for skilled nursing, assisted living communities, independent living, and hospitals in the Denver Metro and Boulder County area.
Excellent. Welcome. Thank you.
My name is Leanne Gray. I am a student in the master's degree program at Regis, doing my practicum for population health at the VA with one of the nurse educators. And I would like to use suicide prevention for a project that I'm doing this semester. So she gave me the information to join the call. So thanks for having me.
Cool. Leanne, who is the nurse educator that is coordinating with you?
Allison Boyer.
Okay.
Oh, great.
Cool.
Welcome.
Thank you.
Anybody else on the call?
Hey, Heather, it's Beth. I just joined.
Hey, Beth, it's Kaylee Clark. We're just doing introductions. Would you mind introducing yourself?
Yes, my name is Beth, and I'm a patient-allied care team social worker at the Aurora VA. I'm also a part of the Veterans Community Partnership Steering Committee.
Thank you, Beth. Welcome.
And then Kaylee, I see we have a Joe Huggins on the call. If you wouldn't mind introducing yourself.
Hey, Joe. Can you hear me? It's Kaylee.
Oh, technology.
I know. Joe, can you hear me?
His microphone's still muted, so he might be having, or Joe, if you're talking, you're muted.
Feel free to interrupt us, Joe, if you want to introduce yourself.
Other than that, looks like everyone's introduced themselves.
Okay.
Oh, one more.
Looks like Maria. Welcome.
Yes, I'm here.
Hey.
Hello.
This
Hello.
is Nancy Clark. Hi. Do you want to introduce yourself? We're just doing some introductions right now.
Oh, of course. Yes, this is Maria Callis. I'm the veteran point person for the Denver Hospice.
Excellent. Thank you so much for joining us. So, today I really hope for us all to be able to share, our interest, passion, and resources when it comes to suicide prevention. For me, it's a really important month, and that's why I wanted to lead this call this month, is because I have been working in the area of suicide prevention since 2012 in the VA Medical Center system. I started off in Cheyenne, Wyoming as the suicide prevention coordinator, worked in Fort Collins and Greeley, trying to actually work with college age veterans who were thinking about suicide and were just trying to get through school. And then I ended up in the Rocky Mountain MIREC for suicide prevention about 3.5 years ago. And since then been really working to work more on kind of national program implementation, so like on a larger scale to help prevent suicide. One program I'm working on right now is called ReachVet, which is essentially helping to identify veterans who are at high risk for suicide and other adverse outcomes, and hopefully getting ahead of a potential negative outcome from ever occurring. And so I'm very passionate about this topic. I know I'm always looking for great resources for suicide prevention, especially among the veteran population. But I also have a private practice as a psychologist in Denver, and so I also have some community resources as well that I was hoping to share. But so I think my hope for today's call is really wanting to learn from you too, like about what what it is that you're doing in your community to help prevent suicide. And hopefully by sharing that, we can gain some knowledge and insights. And by choice only, do I ask that people share? Are there other people, or what are, I guess, other people's hopes for today's call?
Hey, this is Heather, and I didn't explain. So at the AAA, I manage a veteran-directed care program, which is a VA program, but we're inherently, community-based, more case management. So we're not clinical by any means, but so for my hope for this call is to, learn more about how to connect and the resources out there, because we never, try to dip our toes into that clinical field. We rely heavily on our mental health partners and at the VA, all the wonderful people there. So for me, I don't have a ton to offer per se, but just wanted to kind of listen more and how to support our vets. I think we do have a solid, what to do when we hear suicidal ideations and our course of action, of course. But yeah, I just want to learn more. That's my hope.
Excellent. Thank you so much for sharing that. I kind of feel like maybe some people are in the same boat. So that's a good point. How about, other people, if you want to say more kind of about what you do in the area, of potentially suicide prevention, or just what you're hoping to get out of today's call.
Hi, this is Julie with Dignity Hospice. And a few things. At minimum, our administrator will have an in-service every 6 months to our team. We'll reach out to our mental health partners in the county and in the area. Before COVID, they could come in and do a presentation or virtually, or we would provide information to our team. And at the same time, our social work team and chaplains, we always offer support to our providers, whether we have a patient or not, to support their teams, to make sure they're healthy. If they have things they want to talk about, I've been a part of those very safe spaces that allows an assisted living team to talk and share. And for families that they want to come in. So that's one of the things that we do. And it's a nice offering because it's also a good way for us to begin that partnership with, let's say, a community or a skilled nursing that we may not have any connections with, just to say, we're here for your team. We don't have to have a patient. And we do these support groups. We can do them individually. Prior to COVID, we did it, in person. Now we are able to do them through virtual. But it's just been really well received because, as I'm sure you know, in communities, the staff does not have time to sit and think. They've got to keep moving. And this allows them that safe space and to have that support. Thank you.
That's wonderful, Julie. Is there anything that you wish you did have, in support of those efforts, for providers that you're talking about? Or do you feel like you have kind of the tools and resources that you need to be successful with that?
Our social work team has a plenitude of resources. That being said, I can always use additional resources or connections and provide that to them as they seek out, different modalities on how to best communicate. So I would love it if anyone has resources they want to email me. I don't know everything. I keep my ear out and my eyes open, but anything would be helpful.
Great. Okay, wonderful. Thank you so much. How about others? What are you doing in your communities regarding suicide prevention? And then, or, what is your hope for today's call if maybe you're not participating currently in those efforts right this second?
This is Brian, Kaylee. In response to Julie, that was kind of along the lines of what I was going to say as well, is one thing that I was hoping to accomplish from, during this meeting was to share information about VA Eastern Colorado mental health services, given that for a lot of veterans and community members, they feel like the VA is this sort of mystery black box that's so confusing to navigate. And so I did want to plug this recent comprehensive guide to all mental health services in VA Eastern Colorado. I'm going to put that link in the chat box, so if you all can feel free to download that. It was meant to distribute broadly, and to put in the hands of veterans or people who are trying to assist veterans to navigate our services. So please distribute that, share it, and if you have any questions about any of those programs, I will put my email right there in the chat as well, since I'm, again, like a community mental health point of contact, so feel free to reach out to me for questions. And then another thing I just wanted to mention as well is we are having an upcoming statewide mental health summit Normally, each VA facility has their own summit annually based on that facility and the local catchment area for that facility. This year, because of COVID, it's basically all become virtual, and it's also optional if sites even want to have it. And so this year, what we have decided to do is to have a statewide summit in collaboration with VA Eastern Colorado, Western Colorado, which is Grand Junction and Western Slope, and then Cheyenne, which covers into northern and northeastern Colorado. And so I will also copy that registration link and put that into the chat box as well. And again, the focus of the summit is really to foster information sharing, resource sharing, networking between VA and community veteran stakeholder organizations. And we'll have a session moderated by Kaylee for the suicide prevention session. And we'll have multiple other sessions related to COVID and telehealth and whole health and things like that. So I just put that link in there as well, which will allow you to register for the summit, which is October 7th.
Yeah, I'm super happy you shared all of that, Brian, because that's something that I wanted to share too. And so I'm excited about the summit, and just really thank you for all your efforts and putting all of it together. Brian has done an enormous amount of work. I used to put those together in Cheyenne, Brian, and it is a lot. So
yeah, thank you.
Yeah.
And also happy to answer if anybody has any questions, like even right now about Eastern Colorado mental health services or programs, or questions about the upcoming summit. Happy to answer questions about that now if anybody has any.
Hey, Brian, it's Courtney. I got my camera to work, but I still have to call in.
Great.
But I'm very excited about that. Yeah, how does it look as far as having the mental health summit virtually? You said that it's from, I think, 9 to 3. Is that correct?
Or 9 to 3:30. 9 to 3 or 9 to 3:30. Exactly.
Okay. Are there going to be breaks, or what? I imagine no one's done this before, a virtual event like that. So.
Yeah, well, there's some time built in on the agenda for breaks. Yeah. Something else I was going to mention is we have the summits are really to sort of foster like local collaboration and really want to be very localized. But since it is a virtual event, we've also had the opportunity to bring in some like national VA experts in different areas to speak to like what VA nationwide is really doing and some sort of large scale initiatives across all of VA. So that way the attendees will know, this is like what's happening in large VA, and, also expect to see this brought down to the local level at, the VA facility that's in your catchment area. These are things that are going to be put into place locally too.
Wow, that's great. I'm looking forward to that.
Cool.
And so what I'm hoping for, this is Courtney, I'm hoping for from this networking call is to gain as much information as possible and be able to share that with various people who I receive emails from the community, from the VA, and be able to post that on our VCP website to disseminate as much information as possible. So I try to, I mostly act as a liaison between the VA and the community in order to connect everybody with as many resources that are available to veterans, their families, and caregivers.
Yeah. Hi there, it's Katie.
Hey, Katie.
I just wanted to piggyback on everybody so far. So in my role at Given Hour, it's pretty unique. I work a lot at the national level, and then I go down into individual community levels depending on the need. So if there's anything that anybody's looking for specifically, I'm happy to put my email in the chat box, and I'm happy if there's anything that's military or veteran related, I can try to connect you. It's probably something I've seen before, just being in this space for the last 5 years. And the other thing I'm dropping into the chat box while I try to type my email at the same time, is our coronavirus resources. So over the past 5 or 6 months, we've put together some of the resources that we've found that are based on trends that we're seeing within our community. So supporting others from a distance, using healthy habits and emotional well-being to talk to your children, sending them back to school. Some just tips and tricks on how to like take those 5 signs and healthy habits and then apply them to your daily life. So those are all available for download. You'll notice that there's kind of this, I don't know, annoying process where you have to download the file by putting in some information on where you're thinking that you're going to utilize that. The intent behind that is finding out in what ways they've been used and how we can improve and better that process, and then also just tracking and understanding how frequently they're used or how worthwhile they are of the staff time that we're putting into them. But once you download them, you'll get a PDF version or a PNG version, depending on what you want to utilize them for, social media or email. And once you have that version, you don't have to go back in and do that form again. So if there's anything that you see on there or anything that you would like to see, I'm happy to pass that forward to our leadership. We're doing, as always, quite a bit around Suicide Prevention Month. I'm hosting some different webinars based on request and just integrating with our community and just offering that conduit of mental health services, as well as teaching those 5 signs and healthy habits of emotional well-being. So if that stands out to anybody, most of the people I see on the call are very familiar with me and all the things that I do. So I get to see you guys around. But for those of you whose name I don't recognize, I wanted to share that.
No, I really appreciate that, Katie. It just kind of came to mind, that obviously, veterans have choices when it comes to their health care. And so, about 50% of veterans, are not going to necessarily seek services within VA who unfortunately die by suicide. And so what we want to be mindful of is there's not one right way to addressing someone's concerns or distress, right? There's like a multitude of different ways that we can do that. And one of which can be VA mental health services. It can be, community services. I know I've worked with a lot of people that just say, gosh, I just need to go fly fishing, every week. It really just depends. So I do think, Given Hour, I'm biased, but just definitely is a really wonderful resource in the community for people to use, especially if they're not maybe open to VA services.
Yeah, and that brings another point, Kaylee. We intentionally went broad with our eligibility for Given Hour. So we serve all service eras, all veterans, all discharge statuses, so including dishonorable, other than honorable, honorable, under honorable conditions, you name it, we serve that. We also serve military members regardless of their deployment status. So for a lot of the VA services, you'd have to be Title 10 or Title 32 orders to receive care as a National Guard or reservist, which is the program I work on. We eliminate that barrier. And then for family members, it's another great resource for caregivers. We partner with Elizabeth Dole and other agencies that focus on the caregivers, but we serve all military members and their families, all veterans and their families. So aunts, uncles, girlfriends, boyfriends, fiancés, anyone who they consider themselves a loved one of a service member or veteran. And that kind of just touches on that point, Kaylee. And then, when we partner like large scale with VA, we talk about those who are unable or unwilling to seek access through the VA system. We for sure see ourselves more as an additional conduit or an additional resource than replacing all of the services that exist out there. And we share out a lot of information from the VA system and other nonprofits that are working in our arena too. So I appreciate that.
No, thank you. Can you hear me? Okay.
Yeah.
Okay. Hopefully see me. Okay. No, that's great, Katie. I really appreciate that. I'm also gonna, for folks, gonna type into the mental health resource for suicide prevention for VA. Just, I think it's, if you're interested in national veteran suicide data and reporting, this is a great website to go to because it actually shows our annual report. So VA conducts the largest national analysis of veteran suicide rates each year, and so findings are available, on this particular website. And they're also available broken down by state, and so you can kind of see, for Colorado, what are the rates for suicide, especially like for female versus male. We know female veterans are at higher risk, and so when you think about, or when we think about as a community, who do we want to make sure that we're serving as best as possible? Maybe we want to consider what can we do to make, female veterans feel more welcome, as an example. So I'm going to type that in now, and also we'll type in my email address. As I mentioned, I work for the Rocky Mountains MIREC for suicide prevention, and what that means is that there's approximately 10 congressionally mandated entities around the nation that focus on different areas of research, education, and clinical endeavors, really trying to learn more about specific areas of, oh, thank you, Katie, different areas of interest. So some of them might focus on, the suicide risk, or some, which is us, or for instance, severe persistent mental illness as another example. So we have a number of different resources at that website, actually free resources that you can go check out. But let me type in that website for mentalhealth.va.gov, suicide prevention, and feel free to go check that out. That's something I would highly recommend.
Yeah, and the link I dropped in, Kaylee, is actually to the product section. And I was going to tag team on that too. So we've partnered with MyRec through Give an Hour, and we have our rack card on there, and we've seen an incredible number of orders nationally. I think Melissa just gave me the numbers, and I want to say that they're over 30,000. And so that's one of the things that we did at VA National, way above my head, in terms of partnerships. But Melissa made that particular piece through that MOU available. But there's a ton of different resources out there, and we share that with our National Guard and Reserve folks, the ones that I most closely work with when they're doing different suicide prevention events, or events where they're looking for materials to support their service members, and they found a lot of success with that as well. So if you're not sure, there's a lot on there that you can dig through, and I saw a bunch of new stuff on there when I just clicked to bring it up. So thanks for keeping that up to date, Kaylee, and always adding new stuff.
Oh gosh, thank our team, Joe Huggins, I know, who's on the call today. They do a phenomenal job making sure everything is really up to date and reflecting, the great work that's being done. How about for other people on the call? I want to make sure, we have some space for you in terms of what you're hoping to get out of this call, or what you're already doing in the community in regards to suicide prevention.
Kaylee, hi, this is Maria. I wanted to just share with everyone that I attended this week the Suicide Prevention and Recovery in the Face of COVID-19 Summit from the VA, and I thought it was excellent. And Brian, I'm wondering if there's a way that we can share that with everyone who's on this call. I mean, I thought there were some really great points made, and I'm looking through my notes here, and I just thought it was excellent.
Joe, can we hear from Joe? Is he able to unmute? Because I believe they recorded it, didn't they?
Yeah, they did. Joe, can you hear us? I'm gonna try. Yeah, go ahead, Brian.
Non-MIREC is very, active, has a very active presence on Twitter. So I wonder if they might have it linked off of their Twitter page or something.
Yeah, I'll find the recording and actually send that out to people. So I'm going to put together, if you email me, kaylee.clark@va.gov, I will send you a list of specific suicide prevention resources that I've put together for today. And so just feel free to ping me if you would like those, and that will include the recording of that session this week.
Actually, you know, I wasn't able to attend that. I was on the caregiver one. But
Yeah.
what are the trends with COVID and suicide right now? Is it correlated? Is it up? Does it, anyone have any summaries?
So what's kind of tricky, Heather, is that since suicide is low base rate behavior, and oftentimes we get our numbers from the National Death Index, it's often delayed data. So when we find out kind of what the numbers are specifically, it'll oftentimes be a lot later, which is unfortunate. And that's why if you go to that website and look at the data report, you're going to see that that data looks delayed. And it's just because we just can't get the numbers fast enough, which is good, but we just don't have the information available. In terms, though, of like trends, like anecdotally, I know just on calls that I've been on, there like was an increase into calls for the Veterans Crisis Line, you know, especially initially, and people reporting just an increase in crisis. And I think just due to the elevated levels of stress, you know, it sounded like. And so, you know, it was interesting because I think a lot of people had more kind of suicide specific crises. Now a lot of people are calling just because of like prolonged stress and not knowing how to manage, you know. So that's kind of the trends that I've heard anecdotally through the Veterans Crisis Line as of right now. That's a great question, though.
Keely, can you give us your email again?
Yeah. It's kaylee.clark@va.gov.
The other one we're seeing too is like financial insecurity, and increase in those needs and resources as well, and the stress that's associated with that.
Another shameless plug for the summit. Actually, Katie Civiletto will be moderating a session on COVID-related needs and resources like financial insecurity, housing, et cetera, and highlighting some local organizations that can help sort of provide resource information.
And if you want to know who those organizations are, you should join us on the 7th.
Definitely.
I'm just kidding. If you need it, just let me know.
What about other people on the call? Things that you're doing, you know, in the community or at VA to support individuals who may be at risk for suicide, or things that you wanted to make sure that you got out of this call?
Hi, this is Leslie. This is my second week actually joining the Veterans Directed Care Department and working with Heather. So this has been really, really helpful. The resources that are being provided are great. I think for me today was just kind of listening in and seeing what resources I can start using for our veterans. So thank you for letting me listen in. I appreciate it. And hopefully in the near future, I'll be able to participate a little bit more.
Thanks, Leslie.
No, it's great to have you, Leslie. It's good to start building those relationships right as soon as possible, because, you know, then, yeah, I mean, it's all about the relationships and sharing those resources. Glad you could join.
Thank you. Me too.
Kaylee, since I think Joe's actually not even here now. I was able to look on Twitter and then found where they had posted the stream video for the suicide prevention event on Tuesday, and that actually did the live streaming through Facebook. So here in a second, I'll post that in the chat box.
Oh, too awesome. Thank you for finding that.
The one thing I think might be helpful. Oh, sorry, go ahead, Brian. I didn't realize you were still talking.
I was going to say, too, the other thing I posted in the chat a minute ago is the link for the clinical practice guidelines. which is the www.healthquality.va website. There is a clinical practice guideline for suicide prevention. There's others related to like substance use disorder treatment and others. So if any of you are mental health providers or work with mental health providers and want to kind of know the summarized sort of best practices, that's a great website.
Yeah, is the, oh gosh, I can't think of the name of it, Kaylee, the program that allows for consultation.
Oh yeah, that's
Is that one? And then the other thing I was thinking about was talking about like the utilization of the iPads within the VA mental health system and how veterans can get connected that way so that the community is aware of that telehealth support within the VA system for their potential clients that may be eligible for VA services.
Yeah, that's, and Brian, maybe you could help me with that piece, because I think in terms of the iPads and such, I'm trying to think, do you have a contact, Brian, that someone would reach out to if someone was looking for that resource?
To get a VA issued iPad
Yeah.
for video health sessions.
Mm-hmm.
They would just need to ask their provider to place a consult for those.
Okay.
They are able to get those if there is a need, if they don't have a tablet or internet connection, and they need to be able to do video telehealth sessions. Their provider can request that. I know for we had a huge stockpile, and then I think the numbers went down, and there was a bit of a wait. But I think now I believe that's not the case as far as having much of a wait. So I think it's a pretty good turnaround time.
Yeah, actually, because I place a lot of consults for the tablets for another project I'm on, and there's another wait right now, and I'm not sure how long it is, but I'm hoping it's not, months and months. But I know as of now, there's a little bit of a wait.
Okay.
Just a fun fact is even if a veteran's a little hesitant about using our telehealth, we actually have techs who can reach out to them to troubleshoot and teach them how to use the equipment. So I think that's something cool to offer for folks who might be a little reluctant to try it.
Yeah, that's great. I'm also typing in our suicide postvention website. Heather asked in the chat box, and I appreciate this question, just that she's curious about suicide postvention. She's seeing it on the MyRec website. So suicide postvention is really focused on what happens after a suicide loss. And we can view it actually as prevention, because typically each suicidal death results in actually touching approximately 137 people. And so when we think about that, how many lives that one death actually touches, it can be preventative when we do things like support those individuals who have lost someone to suicide, trying to process through or figure out why did this happen. And so this website is really geared towards, if you're, if you've experienced a suicide loss or know someone who has experienced this type of loss, either home, in the community, providers, in your workplace, what do you do? What does it look like? Are there, different ways to talk about this topic? We have a number of different videos available, which I really enjoy because it really depicts kind of how those conversations can go. Yeah, just a lot of, I think, really great resources on this website. So I'm typing it in now if you want to check it out, but feel free to email me directly if you have any specific questions.
No, thank you for that. That's really, yeah, that makes total sense about that kind of model. I hadn't really thought about that before, and the number of how many people it can affect. That was good to learn.
Yeah, I don't have the link in front of me, but there's also the VA SAVE training through PsychArmor partnership too that might be helpful for the community.
Yes, I love that one, and I'll type that also in the chat. And so the VA SAVE training, it can be used really anywhere, but its focus is really on how do we recognize signs of suicide risk, and then what do we do when we recognize someone at risk for suicide? Because really the notion is that it's, you know, everybody's business, that, you know, 22 veterans are dying, or it's 20 veterans are dying per day. It's 2 active duty per day, which is way too many. And so how do we, you know, say if I'm just a neighbor of, you know, whoever, I mean, I'm able to ask those questions. I'm able to get to know that individual, learn about where to refer them, you know, what to do, what to say. And so this training, I think, is really helpful. So I'll post it in the chat in just a minute.
Kaylee,
I
at the
received
conference
some.
on,
Oh, go ahead. Sorry.
oh, I was just going to say,
Is that
Kaylee,
Maria?
yes, I was just saying at the conference on Tuesday, they also talked about the Tragedy Assistance Program for Survivors, the TAPS program. So I thought that was really very interesting. That's how they closed the conference. They talked about post-vention loss, bereavement, and support. And I thought that was just excellent. And I'm wondering, Brian, if you're going to be including something like that in the mental health summit, because I thought that was really helpful.
I don't think we do, Kaylee. Yeah, I don't think we do have that covered in the summit coming up in October.
Could be always something we mention, Brian, you know, like on the suicide prevention. I mean, you know, we could mention it and provide the resource for it potentially if you want to.
Yeah. And I know Tammy will be monitoring the chat, so maybe she might also add in some additional resources through the chat.
Yeah, that'd be great. So
I received some, this is Courtney. I received some resources sent to me from our national VCP coordinator, and I will be sharing those on our VCP website, but I was just, you know, looking them over, and there's several that are in regards to lethal means safety resources. And then 2 others that I thought were pretty interesting: the preventing suicide among older veterans for sure, and the older veteran behavioral health resource inventory. And so I'm going to be, like I said, posting those on our website, but that's from all the trainings that I've done as a clinical social worker. I feel like what stuck with me is I feel like, and maybe this has changed, you know, Kaylee and Brian, and Katie, you can speak to this, but is it still the older white male that is the higher risk of suicide, or the highest risk of suicide? Is that still the case?
Yeah, so it's a great question. So in the most recent suicide report that VA came out with, male veterans ages 55 and older experience the highest count of suicide. And then that's in comparison to male veterans ages 18 to 34 experience the highest rates of suicide. So the frequency is higher with the younger, but then the actual count or number that are dying by suicide is 55 and older. But yes, it's still Caucasian males. And in terms of lethal means safety, 69% of veteran suicide deaths result in a firearm injury. So we try to phrase lethal means, you know, safety versus restriction, because everybody has the right to bear arms, but what can we do to just increase that time and space between that individual and a firearm, just as an example, while they're in that time of crisis, is really the message that we're trying to send. So absolutely really good resources on that website. And I can type that in if that would be helpful.
I have kind of a different kind of question to pose. That's all right.
Yeah.
I'm wondering, so, you know, I'm in the community side of things, and let's say I'm on our information and assistance line. We have one of those, kind of like a 201, that we get tons of calls on. And say like you're on the phone and someone's, maybe it's not a known client, so it's someone who's experiencing some heavy stuff, needs crisis intervention right away. And say they're a known veteran, or they identify as a veteran. What advice would you give to referring to like Colorado Crisis Services versus the VA suicide line? I'm kind of curious, like I don't want to make an assumption just because they're veterans, they want to use the veterans line, but like any interaction with the other kind of crisis services out there, and what would you say to kind of where to direct people best? Is that fair? Or what's been people's even just anecdotal experiences?
This is Beth. So I work at a primary care clinic at the VA, but I also work with unassigned veterans who do not have a primary care provider and might just be kind of using ancillary services. I have directed folks to the Colorado Crisis Line when they've had or expressed like poor experiences with the VA, mistrust in providers, potentially like fear of going to the VA due to like MST, military sexual trauma, or other traumatic events. So that has seemed to be a good avenue for me to provide that in those situations. It's a great idea.
To follow up on your question too, Heather, so if somebody calls a national hotline and they press 1, it routes it to the VA operated hotline. The VA operated hotline, these are VA employees. If the veteran chooses to, they will then also notify the local suicide prevention team based on where the veteran is calling from. So it kind of does set up a continuity of care with VA from that perspective. Sometimes people are not enrolled in VA, but the suicide prevention team locally can help them get registered and things like that, or get them plugged into care through the VA. If they call and they're a veteran and they don't press 1, then it's going to get routed to whatever local hotline handles calls, which could be like the Colorado Crisis Line, for instance, right? That's not a VA operated veteran specific or anything like that. It would handle sort of normal methods, right? If somebody needs to be hospitalized, let's say, if they press 1 and they're routed to the VA hotline, the VA crisis responder may talk to local first responders and say, hey, this person is a veteran. If you're able to, and it's not too far, please bring them to the VA, because we'll accept them. And they can even coordinate with our ER department, patient psych unit to make that all happen more seamlessly, kind of behind the scenes. If they call the 800 number and they don't press 1 and they're routed to the local sort of generic hotline, then they will likely not end up going to the VA hospital unless at some point in there maybe they tell the police officer or whoever on the scene that I'm a veteran and please take me to the VA. So, and then that could create some more challenges if, say, they go to a non-VA hospital but they're a veteran, then the VA would need to be notified in order to try to get the VA to pay for the ER visit or the ambulance bills and things like that would have to be kind of handled after the fact. Sometimes I've seen it where veterans will end up at a non-VA hospital and then have issues trying to get the VA to pay for it if the VA wasn't notified and things like that. So there are just some other factors to kind of be aware of.
That's really helpful. I didn't realize with the kind of pressing 1 situation what that would look like. I've never heard that explained, so thank you.
And I'm typing the numbers into the chat right now. So you'll have those numbers available. And yeah, I love the Veterans Crisis Line. You just press the number 1 for vets. So anyway, but that's, again, 365 days a year, 24 hours a day available. And I know a lot of people, especially when I was working with college students, really preferred the chat option. So I'll type in the VCL website, and it's really helpful, I think, just that people have those different, options, modalities that they can, reach out, especially text-wise these days.
Kaylee, I had a question. Back when I was working in suicide prevention, they only had the one crisis line, and then now they've expanded that. And so, several years ago, oftentimes, like if the VA crisis line was full, it would roll over to sort of non-VA operated crisis lines that would sort of identify that this was a veteran caller as a rollover. But do you know, Kaylee, with like current times, if the VA with the more crisis centers is able to handle all calls without having to roll over to the other lines?
Yeah, so there's been so much pressure, I think from even like a congressional level to make sure that this crisis line is, running at top notch all the time, that they have, really, I think done a really, really great job just managing and kind of bolstering their staff to get coverage for every veteran who is calling in. So I haven't had any reports or even calls that I've been on. I haven't heard of any issues managing that, because I just think they doubled in size. Essentially, they added a whole nother center, and yeah, sounds like they're managing pretty well. But I'm imagining worst case scenario that it would roll over to the National Suicide Prevention Line. So that's not necessarily veteran specific, but it's still available. But yeah, I haven't heard anything that would suggest they couldn't manage.
That's good. That's good to hear that update, because sometimes you hear of a veteran who says, oh well, I called the crisis line and I was on hold or something, and I don't even know. I mean, these are anecdotal stories or hearsay from people, and so it sounds like nowadays, if the veteran calls, that's not going to be an issue, and to try to dispel any maybe past information that's not the case anymore.
Yeah, and I really encourage people, something I like to do kind of here and there is I like to just call them myself and time them. And I like to just kind of see how they answer the phone. I like to know, like when I'm chatting with them online, how they're going to respond to me, how quickly they're going to respond. So I kind of have that first person, evidence to support whatever I'm saying. So I definitely encourage people, check out that website and feel free to just call them and say, hey, I'm just somebody in the community looking for resources, and they'll provide them. They're awesome. They're, again, available 24 hours a day. So feel free to just give them a buzz or chat or text.
I didn't know that, Kaylee. Thanks for sharing that.
Oh yeah, no, for sure. I noticed we're almost at the top of the hour. Is there anybody who didn't get a chance to speak that really wanted to make sure they got to share like a resource that they had, or something that they didn't get off today's call? And again, you can definitely email me directly and I can send you a list of resources talked about today and otherwise. But who did we miss? Okay, that makes me feel good, because I was worried we were like talking and missing someone. So yeah, it's just a real pleasure to get to be with all of you today and get to share this knowledge and these resources. Again, this isn't even the tip of the iceberg. So please do reach out, directly to me, to Brian, Courtney. I mean, if you need a resource, we can find it. So just please continue the great work that you're doing, serving individuals who are at high risk for suicide. I greatly appreciate, the work that you do and your willingness to learn more. So thank you so much for participating today.
Thank you,
Thank
Kaylee.
you.
And just a reminder to everybody that we will have all these resources on our Colorado VCP website. And if you didn't see the website address in the chat box, you can always email any one of us, and we will be able to issue that. So thank you, everybody.
Thank you.
Thanks.
Bye.
Bye.
Thank
Take care.
you. Bye.